reasons the Mediterranean diet has been so successful traditionally is it used to be very, very high in omega-3s because a lot of seafood was eaten. Now, seafood's very expensive. Wild-caught seafood that has been tested for like poison and stuff, even more expensive. So I get my omega-3s through a supplement because I can get the doses I want and the doses I need. And again, our supplements are third-party tested. They're from good bodies of water with lower pollution levels. And we have a good ratio of DHA to EPA, which is what you want. DHA supports cellular membranes and the structure of neurons and things in your brain, and also the connective tissue cellular membranes. And if you have a certain amount of omega-3s in your cells, you're a little bit more flexible. So I tell all of my arthritic patients who have pain and stiffness, not only the Joint Health Multi and Tart Cherry, but they should also consider omega-3s and resveratrol if they're not eating a perfect Mediterranean diet, which honestly, anybody that shows up in an orthopedic surgeon's office usually isn't. Not saying all of you aren't, some of you are. So these are my stacked supplements that I take to help supplement my diet, which I try to make good, but isn't perfect. How do you reduce oxidative stress? Believe it or not, D3. Not only is D3 necessary for bone mineralization, there's a D3 receptor on almost every cell in the body, so nothing works right if you're D deficient, particularly your immune system. Why does that matter? Well, if you don't want to get sick, it matters. But honestly, the immune system is what is repairing your cartilage at night while you're asleep. That is the system that does it. We should all have a perfect immune system if we want to avoid chronic disease. Tart cherry extract we talked about, also a very strong antioxidant, not just an anti-inflammatory. All of the polyglycans found in various species of mushrooms like lion's mane, cordyceps, reishi, all of these are not only great for the brain, they're also great oxidative stress reducers. They can capture that free electron. CoQ10, some of you out there are on statins to reduce your cholesterol, which you should be because that's the #1 killer in our country, heart disease. But statins, by definition, halt the pathway that also produces CoQ10. CoQ10 is necessary in the electron transport chain and it pulls free electrons out of tissue. So if you have less CoQ10, you have lower bioenergetics, particularly in muscle tissue, and most people have muscle pain, brain fog, different little side effects and symptoms of their statins. I would say rather than go off of your statin, you should try to add in a CoQ10. We have a very convenient gummy that allows you to do that. It gives you about 150 milligrams a day, which is the studied level that really helps. You have to take your statin daily, so you would need to take your CoQ10 daily as well. But remember, every time you reduce your LDL receptor, you're also reducing your CoQ10 molecules, and your electron transport chain, meaning your mitochondria, isn't going to work as well. So consider that too, to not only reduce oxidative stress, but to improve your mitochondrial function. NMN. There's a big trend out there in social media right now for everybody to go get these NAD infusions. Well, that takes 4 hours, is massively expensive, and has a relatively great effect, but not sustained. I take NMN instead. NMN daily is converted in one enzymatic step in your body to NAD. So you can get your NAD levels up just with an oral NMN. It's just the precursor to it. Why do you care about your NAD levels?